That's actually kind of controversial.
People are either not wearing it or making homemade concoctions. What's your thought on this?
We will all lose some degree of hair. Your hair does not become coarser from shaving.
What are the 3 best things we can do for our skin?
The most effective product is always going to be, we can reduce those sunspots and the risk of skin cancer.
So really, the sunscreen is the number 1 thing we should be doing. Okay, here's the deal. You need sunscreen every single day. Dr. Landolt will tell you. It's the easiest anti-aging trick out there, and it works, and you need it whether it's sunny, cloudy, or snowing. We're going to be talking about body care, how to moisturize while your skin is still damp, stop stressing over cellulite because nobody notices it like you do. And we're going to learn about Dr. Landolt's ABCD method for checking your skin for cancer. Oh, and hair? We got you covered. From real treatments for hair loss to busting myth that shaving makes hair grow back thicker. It doesn't. She's going to give us advice you can actually use. So if you're ready for no BS tips to taking care of your skin, hair, and yourself, dive in. I'm Dr. Beatrice Seguin, PhD, and you've landed on my podcast this time of the month, your trusty sidekick to the midlife roller coaster. I chat with experts digging into legit solutions for midlife hurdles, be it health or lifestyle. Ready for the ride? Dive into this time of the month. Subscribe and catch the latest episodes on our channel. Let's own this midlife magic together. Skin is our biggest organ. Taking care of it is not just a matter of vanity, it's a matter of health. That's why I'm super excited to have Dr. Sandra Landolt on the show. She's been practicing dermatology for 33 years. She currently practices at the Thornhill Dermatology Centre in Ontario, Canada. She's an opinion leader in the treatment of psoriasis, as well as the management of complex medical skin disorders. She is also Section of Dermatology Chair for the Ontario Medical Association. On a more personal note, Dr. Landolt is an artist and a fiction writer. Her creative abilities are also apparent in her visual approach to skin diseases. She views dermatology as a branch of visual artistry. Dr. Landolt, welcome to the show.
Thank you so much for inviting me.
I'm just so excited that we got connected through social media.
Isn't that just incredible? I never would have ever thought that the power of social media would be that great and far-reaching.
I know. We have to focus on some of the good things about it sometimes because we tend to talk about the negative sides of social media.
Absolutely, because there are many good things.
There are. And one of the things that our community has asked questions about is skin as we age. And so I thought that our episode today could be divided into body, face, and scalp.
I'm all into that.
How does that sound? Okay,
absolutely.
Great. So maybe the first question we start with is, what's the difference between, the changes that happen to our skin as we age, natural aging versus perimenopause?
Okay. So with respect to natural aging, there is normal aging and what we call photoaging. Okay, so that no matter what, as we age, our skin doesn't take care of itself as well. It becomes more vulnerable, more delicate, less able to combat the environment, drier in general. But one very large factor that we can control is that of the sun. Okay, that is called photoaging. So with sun exposure, our skin will be damaged, develop pigmentation, develop areas of skin cancer, develop loss of collagen, loss of elasticity. So if you compare the skin on your face and your hands to the skin on in areas that never saw the sun, so your tush, if you aren't a nudist, okay, there's a really dramatic difference.
That's true.
Totally. The skin on your behind or the sun protected areas is more evenly pigmented, generally speaking, plumper. Okay, and very different from the skin that's been exposed to the sun and the environment.
So really, the sunscreen is the number 1 thing we should be doing.
Oh yes, it's actually the top 10. Number 1, number 2, number 3, number 4, number 5, and so on and so on. So before you invest in any other products, you should really make sure that you're always wearing sunscreen. And I mean sunscreen every day, rain or shine, winter or summer. I, for example, put on sunscreen in the morning after I wash my face. So it's on even if it's a snowstorm, even if I'm not leaving the house. it's already on. I feel safe that way.
Do you have recommendations for sunscreen in terms of independent, standalone versus integrated into, moisturizers, tints, makeup?
Generally speaking, you need to wear a proper integrated, a standalone sunscreen to have adequate protection. So that sunscreen has to have broad spectrum, both UVA and UVB protection, and most of that is not possible to integrate into a tinted moisturizer or a regular moisturizer. Having said that, sunscreen products are better now and tend to be more moisturizing and can be made tinted. So I would look for, generally speaking, a sunscreen product that has those other abilities, or if not, add in those other abilities as a separate tint or a separate moisturizer.
So every day of the year, even in a climate like ours in Canada?
Absolutely.
It can get expensive if you're wearing that, and I know some people don't like it because of clogging. Sometimes they feel heavy. So do you want to walk us through some of the top things to look out for, and if price matters? Okay.
So first of all, you have to look out for good UVA and UVB coverage, as well as, if you're concerned about pigmentation issues, having a tinted sunscreen. Okay, that's a new sort of thing with the tinted sunscreen. So most sunscreens have not been tinted in the past, but now you can look for a tinted sunscreen, or use any product that contains iron oxides, which will be in foundation, or tinted moisturizers in addition to your sunscreen. Now, the biggest barrier to sunscreen use, well, there are two big barriers. One is cosmetic appeal. Okay, so a lot of sunscreens are really not that nice, and the manufacturers have gone to great lengths to make them more cosmetically appealing. In two different directions. Everybody has their own special reason why they don't want to wear sunscreen. The most common one is that the sunscreen is waxy, chalky, and is leaving a white residue.
Yes.
Okay, so a lot of the mineral sunscreens with titanium dioxide and zinc oxide will be like that. Okay, and it doesn't matter if you're a pale skinned person quite as much, but if you are a person of color or of any more pigment in your skin, the chalkiness will become more prevalent, right? So I'll actually bring a sunscreen out of here just to show you.
Yeah, let's take a look.
So, I'm not using this as a particular brand recommendation because that's not what I do, but example of a nice sunscreen that has nice texture, isn't chalky, doesn't leave you white at all, feels like a moisturizer would be this one. Okay, this is actually the Eucerin Complete Hydrating Lotion.
Yeah,
and we can take some out.
Yeah.
Put some on you.
I'm going to put it on my leg.
Okay.
Because we're talking body.
Right.
And we tend to ignore some of these parts of, right? I tend to be better on my face than on the rest of my body.
So how does this feel to you?
It feels really moisturizing. And in terms of white cast, which bothers me a lot, I don't see it.
Right, exactly.
Yeah, so it's nice. And it feels, they have come a long way in terms of the more moisture.
So a sunscreen being more expensive isn't necessarily a better product. So for example, this large bottle of sunscreen would be marketed for the body, so it's 150 mils. It's in the $24 price range, which would already be expensive for most people.
Yes.
All right, but you don't have to be looking at sunscreens that are salon quality or medical grade, because they're basically the same sunscreens made by the same manufacturers, but they may have slightly different appealing factors to them, including maybe just the label, to be honest.
Yeah, and so that's what we really want to drive home, is that as long as it has the broad spectrum, you can go for the less expensive.
Well, this one also has the Canadian Dermatology Association logo on it.
Does that matter?
Well, it actually means that the CDA has looked at the sunscreen and approves it.
Okay.
Okay, so it matters. Okay, it's important. If you see it there, you can feel reassured. But we'll get to that in a moment, because we're going to talk about maybe sunscreens that are less expensive, and they may not actually have this logo on it.
Okay. But if, it's a good sign to have
It's a very,
that.
very good sign,
great.
absolutely. I would highly recommend the sign is there, but sometimes we have to be more practical.
So Dr. Landolt, this is chemical sunscreen. Do we want to stick in that category, or do we want to switch to mineral, for example?
We can do both. Okay. The main reason for mineral sunscreen is that at some point in time, we did not have, especially in North America, the screening agents that have a broad enough spectrum of coverage. So in terms of long UVA coverage. So in North America, many sunscreens have both mineral and chemical components in order to use the mineral to cover what is missing from the chemical spectrum that we actually have available to us. So if you look at sunscreens in different countries like Europe, Australia, especially Asian sunscreens, Japan and Korea, they don't have as much of a mineral component because they have better sunscreen agents. So the FDA hasn't approved a sunscreen agent since 1999. All right.
Why is that?
Probably for economic reasons.
Yeah.
All right. So that the FDA is a drug approving agency, and the HPB follows their lead on the whole. So most cosmetic companies don't have the budget to become approved as if they were a drug, right? Especially smaller companies. So that as a result, these agents have not been approved for that many years because they just haven't.
You've shown us chemical sunscreen, and I've noticed in the last year or two this huge backlash against them and this fear that they disrupt our endocrine system. So people are either not wearing it or making homemade concoctions. What's your thought on this?
That's absolutely not true. There's no evidence at all to support that. Sunscreen is perfectly safe.
So, and what are the downsides to making it at home? You could get sunburn, or you're using ingredients that aren't even doing what you think they're doing.
They all seem to be like essential oils. Like, how are they going to?
How is an essential oil going to protect you?
No, it's not. Absolutely not. In fact, if anything, the oil might even drive more sun in because it's like attracting the light.
Yes.
So no homemade sunscreens. Always buy sunscreen that says it has UVA, UVB, broad spectrum coverage, and if there is a seal of approval from some dermatologic society, even better.
Can you explain to us a little bit, though, in terms of what is and what isn't an endocrine disruptor? So why is the sunscreen not doing that?
So none of these products are actually systemically absorbed to disrupt anything, apart from the fact they don't contain ingredients that are endocrine disruptors. Okay, I'm actually not sure what people feel endocrine disruptor is, but something that is going to affect your hormones would be what endocrine disruptors should be called, and these things are not present.
In sunscreens?
In sunscreens or other creams.
Other topical products.
Other topical products, exactly.
All right.
The whole concept of endocrine disruptors is controversial to start off with, but let's take it one step further. So if you are using a product that somebody believes is an endocrine disruptor on your skin, it's actually going to have to get into your system through your skin. Okay. So one of the biggest functions of our skin is to protect the rest of our body to start off with, all right? So that whatever you're putting on your skin is going to have to go through the stratum corneum. We talked about the top layer of skin, the stuff that's that makes our skin like impermeable. Okay, it's even called the horny layer. That's one of the dermatology terms for it. So it will have to pass through the horny layer to be absorbed into our skin, into our body systemically. Now, there are certain things that are designed specifically to be absorbed into our body.
Like my hormone therapy.
Exactly.
Yes.
All right.
But that's the vehicle it's in,
That's the vehicle
correct?
itself. And then you also know that using topical progesterone is not effective because it cannot absorb into the skin. Okay, so essentially, most of these items that are believed to be hormone disruptors, they're not even getting through the skin to start off with.
So, okay, so there might be their combinations. We want to use them every day. That's the biggest bang for your skin protection dollar, if you will,
Absolutely.
on the body. We talked about, would be considered mid-price.
This would be considered high mid-priced. And if it's marketed for the body, it doesn't mean it's not fine for the face.
We tend to think that.
Absolutely, but that isn't true at all.
That's marketing.
That's marketing. Mm-hmm. And in fact, the similar version to this for the face feels identical, actually isn't quite as nice. It's 1/3 the size and it's the same price.
So if you like this, use it on your face.
Absolutely.
So is a lot of labeling like that not necessarily real in terms of face cream, body cream? Because The skin, we're going to talk about how it can be different, our face and the rest of our body. Is it different? That's the question.
So there may be added factors in a face cream, and a face cream might be more moisturizing. But on the whole, you can use a body product safely on your face.
Good to know. All right. Do we want to look at some more budget-friendly sunscreens? Do you have that in your bag?
I didn't actually go and buy them when I was at the dollar store.
Okay.
So what prompted me to think about shopping at the dollar store for sunscreen was a recent article in the Journal of the American Academy of Dermatology, basically looking at whether there were decent sunscreens available in the dollar store, addressing this economic issue, okay, in terms of patients having access to decent sunscreen at a better price point. So they estimate that a family of four, if they were using sunscreen properly, would spend $600 a year on sunscreen.
That's not insignificant.
That is not an insignificant amount of money, which actually makes it inaccessible to families that are of a lower income to actually be protecting their entire family properly. Right?
And we don't want that.
No, we don't want that. So they went to Dollar Tree. Okay, this is in the States, and they looked at the various sunscreens that were available there, in the $2 to $4 price range, and they found that they met all of the American Academy of Dermatology standards, so it would be similar to the Canadian Dermatology Association for sunscreen in terms of broad spectrum UVA, UVB coverage, organic, which means mineral as well as chemical, and I forget what else, but it was basically all the things you would look for in a sunscreen. So I decided to go to the dollar store to have a look myself.
Yeah.
All right. And so I went to Dollarama at first, and they had sunscreens that were available, but they were low on stock because it was after the summer, and they told me that was the reason why there was less sunscreens. But they did have Coppertone and Banana Boat. Okay, so neither Coppertone or Banana Boat have the CDA little thing on them, but they are decent sunscreens. They do have broad spectrum coverage, so there's no reason why you can't be using them. And although we may not be actively recommending them to our patients, they are perfectly fine to use.
So that is really good to know, because we don't want to skip out on sunscreen for economic reasons.
No, absolutely. Then afterwards, I went to Dollar Tree, and there is a Dollar Tree somewhere around here. And I was looking for the sunscreens, and I couldn't find any sunscreens, but I did find that they had an incredible selection of general skin and wound care products. So they actually had more than the drugstore in terms of first aid and that sort of thing. So I found a lady to help me, and I asked her about the sunscreens. And she turned around to me and she said, "No, ma'am, we don't carry sunscreens at Dollar Tree." She goes, "But I'm going to tell you one thing." And then she explained to me how when her granddaughter was born, her daughter was looking for a certain brand of sunscreen for a toddler, all right? And the one that she wanted to buy was $44 a bottle. Okay, and it was a huge economics barrier for them, but they did buy the sunscreen. And then she said she really wished that they sold the sunscreen at her Dollar Tree store. And I was just thinking, this is like she's reading my mind. I can't believe this.
So it might take more effort, but good to know that there are budget-friendly sunscreens. Right. You might have to look for one, but the lesson there is you're not compromising your sun protection by going for the more affordable products. So that's really good. You're not missing out.
Fine. Yeah. And in fact, wearing the more affordable product is clearly better than not wearing sunscreen.
Always.
And that's the alternative.
That's right. That's good to know. Okay, so I recognize, we can't change genetics, okay, when respect to the skin that we inherit, and we know sun protection to prevent photoaging is critical, but all of us are a little bit delinquent, shall I say? So we know we need to do better on our sun protection. But once we've taken for granted that we're putting on our sunscreen, Dr. Landolt, we're still going to get some photoaging damage. We're not getting zero. Our lifestyle may impact our skincare, or skin health. So what do we do once we take care of the sunscreen? what are the things we can do for our body to keep it healthy, hydrated, certainly through midlife. I've noticed the legs especially, they seem to just not be able to stay moisturized. So what's your advice there?
So, I mean, there's different types of moisturizers, okay? Some are emollients, and emollients are creams that actually lock in the moisture by creating an occlusive barrier, all right? So, an example would be something even like Vaseline. Okay, so Vaseline and other products that do contain petrolatum will actually act by locking in the moisture. So the best way to use those is to actually be damp. So your skin still be wet when you put the moisturizer on. That's an occlusive type of moisturizer. So moisturize after you shower. Before you towel completely, you can kind of like shake the water off a little bit and then just moisturize all over, and then you can pat dry after that.
So let's take a step back. If you're doing your ideal body care routine, walk us through step 1, 2, 3. Ideal. Even pre-shower, should we do something like exfoliate pre-shower,
Well,
shower?
No, you don't really have to.
Okay.
Okay. I really feel that the body takes care of itself best by doing a little bit less as opposed to more. So my favorite recommendation for exfoliation is actually a slightly abrasive, low quality like face cloth. So not actually a particular actual exfoliator, but like a dollar store quality washcloth.
Okay.
And actually using it in the shower to exfoliate whilst you're washing yourself.
Great. And then step out damp.
Step out damp and then
Vaseline.
moisturize all over.
Do you then add a moisturizer, or no, Vaseline would be enough? Because I would have never thought to use Vaseline.
Well, adults usually don't like using Vaseline, but Vaseline's really much better for like babies, etc.
Okay.
But what I'm really saying is that a lot of the emollients do contain some amount of Vaseline in them, so they contain petrolatum, and that is actually what's making them a better moisturizer.
All right. So what else should we be doing? What are some of the latest products or treatments that can help keep our body skin
you were
well?
mentioning to me before we got on to the show how you like using the urea-based products.
I love those. Yes, thank you for reminding me. So especially for heels, the really dry side, like our heels, our feet. Sometimes we get that on the elbows too. So for years, I've been using a product with 25% urea in it, and it's miraculous and not expensive. So what are your thoughts on that? And maybe,
So I mean, that's great, okay, because it does have that moisturizing quality and almost like exfoliating kind of quality to it, so it's wonderful. And you can use the ones with a little bit less urea, and they don't act like emollients, they act like something called humectants. Okay, so humectant is different. It isn't sealing the moisture in, it's actually drawing the moisture into the skin. Okay, like humidifying the skin, that's why it's called a humectant. So that you can get urea products for super dry areas like the feet and the elbows and so on.
Hands.
And hands, and others just for the rest of the body to get rid of that kind of like Sahara Desert look, I guess is the best way of describing it.
Yes. So lower percent urea would be what? What percent
like
range?
5 to 10.
5 to 10. Okay, so look for products with that range for rest of dry areas. So the 25% is for the really intense
it's more
issues.
for the heels and the feet.
All right. So what have we not covered on the body? Cellulite? Should we talk a little bit about cellulite and what can be done for that? If it bothers you, it's normal.
It's very hard to get rid of cellulite, okay? There really aren't that many reasonable proven treatments, okay? So you're kind of stuck with the cellulite, right? The only thing I guess I can say is that it's never as bad as you think it looks. So that's part of our own body image, right? So that, you have to at some point in time become at peace with certain, what you consider your flaws. And I mean, if cellulite's your worst flaw, you're still beautiful.
Thank you for reminding us of that, especially with imagery everywhere around us, whether it's traditional print magazines, social media. It's also filtered. You just don't see it. So you feel like you're the only one who has it, and somehow it is a flaw, when in fact it's perfectly natural.
I think you have to remember, and I tell patients this, that you are your worst critic. Okay. Just realize that however you think about yourself, you are your worst critic, and that is not how people perceive you. And that includes our physical appearance. People really are really hard on themselves, and it's not good for their self-esteem.
That reminds me of a book I just read where the author says that our body is designed to experience life. It is not the object.
Oh, that's amazing.
Isn't that nice?
Yeah.
And it really reframed
Oh, absolutely.
things for me when I read that. So I think we need to remember that when we think of us, when we look at ourselves in the mirror, because we are the worst critic.
Absolutely.
Yes. Okay, so should we move on to our face?
Sure.
Lots of questions there, lots of ingredients. So many trending things. I don't even know where to begin. Should we stick to evidence-based ingredients, however old they are? What truly works in our skincare?
Okay.
For mature skin.
Okay. So for mature skin, so no matter where the trends go, the most effective product is always going to be a retinol or a prescription topical retinoid. There's nothing more effective than that, okay? So it's not everybody can use topical retinoid or topical retinol. So certain skin conditions like rosacea and very, very delicate skin may not do as well. But in most situations, you can train patients or people to use a topical retinoid by using it sparingly, using it in conjunction with a moisturizer, and not rushing it, going slow. This is not a race. Getting trained onto a retinoid is not a race.
So, okay, let's walk through that. Sparingly means not too much on your face, like.
Okay, sparingly means if you're treating your face the size of a small pea, the vegetable, not like a blob.
Yes.
Okay? It would be the correct amount to use for your entire face.
Okay. Probably people overuse it. Frequency?
Frequency means start infrequently to work up to a greater frequency. So the average patient or person, I would suggest starting maybe twice a week.
Okay.
Okay. If somebody's very, very fair and hasn't used a topical retinoid or retinol before, I would suggest starting once a week. Right? And then slowly working up to every night. And if you can't work up to every night, it's not a failure. Not everybody can.
Right.
It's a goal, but it's not a goal that you have to meet.
Can we put the retinoids on our hands as well? Because hands definitely age.
Absolutely.
Okay.
And in fact, everybody should be treating their hands and their neck and their chest area, because you can always tell when someone's been really good about their face, but the rest of them kind of like, you just look at their hands, oh my God, what's going on there?
Okay, let's not ignore these parts.
Definitely use your either retinol or your prescription topical retinoid on your hands, and make sure you're always wearing sunscreen on your hands. And if you want to, you can even buy protective sunwear, including driving gloves to wear on your hands, and that way you don't have the exposure through the glass.
Yeah, especially if we're doing a lot of driving. That's really good to note. Now, I have a question when you're talking about hands and sun exposure. Many of us like doing our nails at the salon with the UV treatment.
So apparently
Is this
it's not
good,
UV
bad?
anymore.
It's not UV anymore?
Yeah,
okay.
I think you have to make sure that they're using LED lamps.
Okay.
But it's not UV anymore. But what you can do if you're quite worried is you can buy some gloves, cut the little tips off so your fingernails are sticking out, and just have them do your nails that way.
No concern for the actual nail bed? And I'm asking for our listener, just the association of that with
so it
cancer,
is supposed
skin
to be
cancer.
LED lights now.
Okay.
So that there should not be any more UV lights.
All right,
okay?
so
but
check
just make
that
sure
it's
at the
not.
salon. Okay, so the salon should do due diligence and actually be telling you the truth.
That's good to know, because I didn't know that they had updated. So make sure your salon is using LED. And I want to, we'll get to what we do when we can't tolerate the retinols, but just a little parenthesis. Is there an age at which, and we're talking about midlife here, but is there a recommended age at which you start this routine, and the same at an age at which you should not use retinol? Because I see this trending in young teenagers.
Okay. So I actually don't have a problem with young teenagers using, quote, retinol. All right? Because when you think about it, a lot of them have acne, and they are given a prescription topical retinoid. All right? So there's no harm in having a young person use like a vitamin A topical product, because it is part of regular treatment of their skin to start off with, and will be helpful to start off with in terms of acne and that sort of thing.
Okay.
Okay. The other thing is that if you ever see older people that had teenage acne and say they were on Accutane at some point in time and ended up afterwards starting on, at that point it would have been Retin-A, okay, because Retin-A is the first retinoid. You will notice that they have aged much better than their peers, okay, because they started using tretinoin, Retin-A, whatever, at the age of maybe 18 or 19 years old, and they're 55 now and they never stopped. There are things I don't agree with in terms of young people being like talked into doing on TikTok and so on. It's marketed.
Yeah.
So like baby Botox or starting with filler and really things like that. But I don't have any problems with young people starting using retinol or retinoid, because there's no reason why they can't be using it and it's not harmful for them.
Okay. For those who can't use it, what would be an alternate evidence-based ingredient that will give results?
So vitamin C would be a good choice. Adding in like niacinamide would be a good choice. Those would be the main ones.
Vitamin C, you want to tell us what it does for our skin?
So it's an antioxidant, and basically which makes it a cancer-preventing agent, okay? And it also helps sunscreen be more potent. So vitamin C is something you should be using if you're using in the morning. So at the time whereby you need an antioxidant in order to prevent oxidation.
Exactly. And the sun damage. Okay, so would you do your sunscreen then vitamin C, or vitamin C cream and then sunscreen? What's the order?
So that's actually kind of controversial. Okay, because different sunscreens work in different ways. All right, so that if you're using a chemical sunscreen, like the one we were just playing with, it is a screen, not a blocking agent, okay? So the chemicals are actually incorporated into the top layer of your skin called the stratum corneum, and they become part of the stratum corneum. And that's how they protect your skin. They actually filter out the rays. They don't bounce off the rays, okay?
Got it.
So you should actually theoretically be putting that on first so that there's more absorption into the stratum corneum, so the top layer of the skin. And fun fact, if you're wearing sunscreen every day, even though it degrades and so on, because some of it is incorporated into the stratum corneum, there's actually still some there persisting. Okay, so that if you mess up one day and you weren't as good about your sunscreen, you would be slightly protected because the sunscreen has already been incorporated into your skin, if it's a chemical sunscreen.
Right.
Okay, so the sunscreen should go on first with the vitamin C on top. Okay, but most of the North American sunscreens are not strictly chemical. They're mostly blended because they had to be in order to achieve an adequate spectrum of coverage. So because there's the mineral component, it would have to go on last. So if you're using a strictly mineral sunscreen, that always goes on last.
All right.
Okay. And things like mineral makeup powder, they are a mineral sunscreen per se. They go on last.
Okay, so we talked about retinols, vitamin C, niacinamide. What does that do for our skin?
So it's also a cancer-preventing agent, skin plumping agent, and an antioxidant. It does all those things. It's present now in a lot of cosmetics. It's become very popular.
I've seen it, yeah.
And you'll see it quite commonly also built into sunscreens as one of the agents. I'm not sure most sunscreens that contain niacinamide have sufficient niacinamide, because if you read the label, they're as an ingredient, like a name, but it's down the bottom, yes. Like down there, maybe below water. Okay,
yeah.
Right, because water is a big ingredient. Okay. So, because you need at least 5% niacinamide to be helpful. So niacinamide's great. It's in a lot of cosmetic products, but you should check to see how much niacinamide is actually present.
Yeah, it's not always divulged. by brands,
when it's
the
not divulged,
percent.
it means there probably wasn't very much.
Yeah.
Just by inferring that it wasn't very much. And in fact, in dermatology, we even use niacinamide by mouth, so orally, to prevent skin cancer.
Fascinating. So to prevent skin cancer,
Yes.
so is that for high-risk patients?
That's for high-risk patients. So patients that have a lot of sun damage, a lot of what we call actinic keratoses, so precancerous sunspots, we can reduce those sunspots and the risk of skin cancer by taking niacinamide.
That reminds me, how often should we get our skin checked? Is it your primary caregiver, or should you go to the dermatologist once a year to get your skin checked?
Well, you should definitely have your skin checked by your primary care provider, your nurse practitioner, physician, or whoever you are seeing for your general skin health needs. If it was the ideal world, people who are at risk, so fair-skinned, family history of melanoma, family history of early skin cancer, other maybe genetic reasons why they would have a greater risk of skin cancer, should be seen by a dermatologist maybe once every 1 or 2 years. But that's not possible where we live. Okay, so in Ontario, there are 280 dermatologists and 15 million people. Okay, so that works out to, I think, 80,000 people per dermatologist.
It explains the wait list to
so
get into a dermatologist.
No, exactly. So I mean, someone who knows how to look at your skin should be looking at your skin, including yourself. Okay.
What should we look for?
So I mean, you should at least once a month take off your clothes, stand in front of like a mirror without your clothes on, with a little hand mirror to see the back and the front, and just get an idea of the general geography. Okay, so that look at your skin, look to see what spots you have, all right? And if the spots are irregular, have more than one color, multi-pigmented, greater than the size of a pencil eraser, so greater than 6 millimeters, and have, what did we go through? We went through all of them, I think. Asymmetry, yeah.
Yes,
also,
asymmetry.
I skipped the A, that was supposed to be the first one. So A, B, C, D, asymmetry, irregular border, color, and diameter. Okay, and just get to know your skin, all right, and look in all the places. Use mirrors to look in your private areas. And when you go and get your hair cut or colored, have your hairdresser look at your scalp. See if anything's cropped up there, because they're usually the first person to notice something that's new on your scalp.
Okay, so something to add to your self-care routine.
Right.
Look at your skin, get to know it, and if you have changes...
Make your skin your friend, exactly.
Your skin is your friend, and if you notice changes, don't ignore it.
Right, and I mean, when I mean changes, I mean any change, okay? So a lot of times the changes are normal, okay? So people get age spots. Age spots are normal, but you don't have the ability to be the judge of that. So if you see something that's different, then show your doctor.
Okay.
Or whoever is taking care of you from a health point of view.
Yeah, that's great advice. Okay, so now I want to talk about some trends in treatments for the face, and I mean this could go on forever. So we'll try to cover some of the main ones that I get asked about. Infrared therapy. I see masks trending.
Yeah, the red ones.
Devices.
The red ones are really big now.
They're really big now. What's the evidence there? Is it worth the money? What does it do?
There is some evidence that they're beneficial. Okay. For all types of aging, okay?
So we're talking fine lines, we're talking...
Mainly fine lines, okay? So I don't own one, all right? But I don't have the time to put these things on.
Yeah, how long do you have to wear it? Like, and how frequent, if you were going to follow a regimen?
I think it's like at least 3 or 4 times a week. But I mean, they're fairly new, so we don't really know,
we don't
right?
know.
Exactly.
Okay.
They're not harmful. We don't think they're harmful, okay? And a question I was asked is, will the red light worsen pigmentation? Because when you think about it, it is a form of light, right? And the answer I understand to be correct, because I've been researching it, is no. It's fine to use if you have problems with pigmentation.
Okay.
Okay, but...
So not harmful, but really what the upside is not some tremendous upside so far.
So I'm a very keep it simple sister kind of person.
Yes.
Okay, so that's my mantra. So it doesn't fit into one of the things I'm planning on buying or doing. If someone gave it to me for free, it might sit in the box. I'm being perfectly honest from that point of view.
Yeah.
And if I had time, I might try it, but I don't think I would ever have the the time and diligence to be wearing it 3-4 times a week.
Okay, so what would you invest time or money in that will show, significant changes?
From a procedural point of view?
From a procedural,
Okay.
let's talk
All
about
right.
some procedures. And I think when we talked on the phone initially, we mentioned replacing collagen versus stimulating collagen.
Right.
Volume loss versus stimulating.
Yeah. So I think people are quite talked into and interested in replacing volume. Okay, so because that's kind of like it's not a cheap and dirty; it's an expensive and dirty. And what I mean by that is that you see an instant result. Okay, it's not as if you want to be filled up or whatever for before you're going to be doing some event or for a new job or whatever. It's you will have some result very quickly, and so you don't have to invest in time and effort. Okay, but I mean these changes are going to be temporary and gradually dissipate, and we all know that, and we accept that, and there's nothing wrong with that. But that's kind of like an instant result sort of situation. So there are other things you can do to try and kind of like rebuild your own collagen. Okay, now going back to the retinoids will rebuild your own collagen slowly and gradually, and it'll be a long time, but it's going to be doing that over a long sort of like a long trajectory, but not a like trajectory that's like this. Okay, you can also do some of the skin tightening procedures like radiofrequency. Okay, so that will rebuild your own collagen as well. And often, if somebody wants to do more than just creams and so on, I will suggest radiofrequency with microneedling to rebuild your own skin, because it will do it and give you a base, like an ongoing improvement of the base, that you can do other procedures on top of if you should want to, but this is something that's more lasting as opposed to more temporary.
Now, when you talk about the microneedling to stimulate that collagen production, I've also seen at-home type products that promise microneedling-like effects.
Right.
What's the deal there?
They're never going to be as effective because it would be impossible to provide the same depth and also the other things you might be doing with it, like the radiofrequency or PRP or whatever they're trying to add into the microneedling. My concern is that the biggest quality control of any device is the person who's using the device, okay, which is the patient or the person, right?
Yeah.
So you could hurt yourself. You could have some adverse effect. You could have some scarring. So you really have to have some idea as to what you're doing, because now you are now responsible for providing your own, what I would in the past have considered a professional type of treatment.
That's really important to note, because I do see a trend in that. So perhaps, keep that
I've even
in mind.
seen certain influencers having people use that microneedling device to microneedle the Rogaine into the scalp.
That's interesting.
So I can't imagine microneedling your scalp every day with your Rogaine.
And what are some risks of doing that? Are there?
Well, you could have an infection.
Yeah.
Absolutely. Mm-hmm. And anyway, it's a trend, and it's not one that I encourage that people follow.
Speaking of trends, more trends, the use of tallow on the face. Have you heard of this? Tallow cream?
Well, that's like beef wax, right?
Yes,
beef
it's beef
fat. It's the sort of stuff you make candles out of.
Yeah.
So I'm a big fan of Vaseline, okay, because we know that's safe, we know that's inert. I'm not quite sure why you would start to use like an animal protein version. That doesn't really make sense to me. So I don't think you can really harm yourself by using it, but I can't see the benefits, to be honest.
Do you think petrolatum gets a really bad rap?
It does. Absolutely. But there's really no reason for it.
Yeah.
It's the safest thing you can use on your skin.
Okay, so sometimes safe and simple and inexpensive is the way to go.
I even brought my own.
So don't
I buy the
underestimate
big
the
jar.
power of the Vaseline. Yes. Yeah, it's fascinating how sometimes we just feel like we need newness as opposed to the things that are tried and true. And you mentioned Rogaine. We'll get to Rogaine when we
Okay.
talk about the scalp. So what about there's a lot of injectables. And I don't want to spend too much time, but PRP is not just for the scalp. Can you do it for the face?
Oh, yeah.
Okay.
All right. Okay.
Is that
So
effective?
you're basically taking all the growth factors from your own platelet-rich plasma and driving it further into the skin, okay? So PRP is effective in some patients with hair loss, not all. In order for it to be effective, there has to be the ability for the hair to be able to grow back. Okay, so now we're talking about midlife, okay?
Yeah.
So midlife women particularly, they have female pattern hair loss. So the same as male pattern hair loss, hormonal hair loss, because when your estrogen goes down, essentially you develop more male sort of characteristics. So if there's any possibility in your family history of having male pattern hair loss, you will potentially develop female pattern hair loss. And it's actually very common. So you were talking about Dr. Donovan when we were talking on the phone.
We had a fantastic
right?
Zoom with Dr. Donovan, and we talked about, yes, it's
Right.
very emotional for people. I think it's one of the top complaints.
So
yeah, hair loss.
around the same time that you were talking to him, I was actually attending a Zoom lecture that he was giving, talking about female pattern hair loss. And do you know that 50% of menopausal women will develop female pattern hair loss?
That's a high percentage.
So that's actually a variation of normal in that case, is I guess the point that we're trying to make. Okay, so that as we age and our hormones decline and we develop other signs, we will all lose some degree of hair. Okay, so I mean, I think my hair is pretty good.
Your hair is fabulous.
But I actually started myself on oral low-dose minoxidil. Well, I actually had my doctor start me. I didn't literally start myself. That would be just weird. But it was my idea. Because I could tell that my hair wasn't quite as thick as it used to be. And it's a safe treatment and it's fine. And for me, I felt it would be easier for me to do that than to use Rogaine. But Rogaine is also a perfectly fine choice.
Sorry, just to distinguish for our listener, minoxidil and Rogaine is just a trade name, I thought. They're not actually, or are they actually different ingredients?
No, they're the same ingredient.
They're the same ingredient,
okay.
yeah.
So Rogaine is a trade name, okay, and minoxidil is the medication that became Rogaine when it was made into a topical preparation. Mm-hmm. So minoxidil is a hair loss topical preparation as well as old-fashioned blood pressure medication taken orally. Right. And going back many, many years ago, when people were taking minoxidil orally for their blood pressure issues, they became more hairy. Okay, and that's how they
a nice side benefit, which now has become. Dr. Donovan mentioned that the topical, super safe, lots of evidence. A lot of people seem to not want to use it. I'm not sure. So, any downsides to it?
There's no downsides to using Rogaine or topical minoxidil, other than it's very difficult to keep it up because you have to do it every night.
Every single night you rub it in?
Right.
Okay.
You have to do it every night, and if you skip nights, it's probably fine. But because it's faking your hair back, it's giving you the hair that doesn't belong to you anymore. The hair that's growing with the Rogaine is the Rogaine's hair, not your hair. No, I mean, that's true, okay? So if you skip a lot of nights, there's the Cinderella effect, okay? So that the pumpkin comes in and the ball gown's leaving and you're going to lose the hair. So people are afraid of the fact that the hair doesn't belong to them and that they have to keep this up for the rest of their lives. Okay?
Is there a little bit of hair loss that can happen at the beginning when you're initiating treatment with minoxidil?
There can be, and for some people it's actually quite alarming. There is the hair loss because the hair cycle syncs itself. So it's kind of like or reboots itself, however you want to think about it. Okay, so that your hair grows and then rests. So when your hair is growing, it's in a cycle called anagen, and when it's resting, it's in a cycle called telogen. Okay, and that's also why people lose hair in certain situations, like post-pregnancy, because the cycle gets messed up and everything's moving into the telogen phase. So the minoxidil does something kind of similar. It's trying to sync things back into the anagen phase, so there can be a temporary kind of like misstep. But it is temporary. It's not a permanent thing. So that's some fear people have. And in my experience, actually, it's very uncommon. So that patients will focus on this possibility of having this shedding period. But it's not that common. And to be honest, the shedding isn't the loss of hair. It's shedding, but shedding means it's going to return. It's not a permanent thing.
Okay. So not to be so afraid.
But if you're using Rogaine and you're not good at it, okay, so you're using it, you use it for a week, and then you forget for a week, you don't take it on holiday with you, you don't do it on the weekends, you don't do it if you've been partying, the list goes on and on and on. Eventually you'll get to the point whereby you're messing up the cycle, right? Because you're not doing it how you're supposed to do it. And so that's and it's also hard to sort of like accept that you're putting something that's, I'm going to say for some people, depending on their hair texture, slightly messy into their scalp every night. Okay, so that if you're somebody who's got very fine hair, you may find that it ends up with styling issues the next day if you're putting in the Rogaine.
So it's a time commitment.
So it's a time commitment, and it's definitely a commitment.
But what else can be done?
So
PRP.
You can speak to your doctor about taking it by mouth.
Okay, so with the oral, yes, I remember talking about that. Are there concerns of facial hair? Because it's so weird in mid-menopause, you're losing hair on the scalp, but you're gaining hair in places you don't want it. And then if you take oral minoxidil, will it make it worse on the face?
There is the sweet spot.
Okay,
so the answer is yes. It will theoretically make it worse on your face, but the extra hair on the face is dose dependent. So if you are able to take the least amount of minoxidil to grow more hair on your head and not grow hair on your face, then you're usually fine.
Okay, good to know.
So that most patients can balance that out.
And are there major side effects to be expected with oral minoxidil?
It's uncommon to have major side effects because it's a blood pressure medication. It can lower your blood pressure. What I tell people to do is take it at bedtime. So if their blood pressure is a bit lower, they're sleeping after they've taken it.
When we were talking about the face, so I think laser for scalp. Are there types of?
Oh yes, actually, the low-level light cap, so the Theradome cap. Okay, so I always thought that was some kind of like weird, like hoaxy kind of thing. I guess kind of like deciding whether the masks are good or not. Yeah. Okay, but there's actually good evidence that the low-level laser cap is effective in growing hair back, almost as well as, not as well as minoxidil, Rogaine, but almost as well as minoxidil. So I do recommend it to patients. You can buy one, but you do have to wear it.
Yes. Every day?
I think every day for as long as you can. I think at least a couple of hours. Okay. So, but I mean, you could be wearing it when you're like doing stuff on the computer, watching Netflix, studying, whatever. So it's an
option.
It's an option.
So if you were to classify the two top options for hair growth, it would be topical minoxidil, if not oral, but possibly.
So I think for most people, most people seem to add the cap in. I don't really know of anybody who's just doing the cap by them alone.
As an additive.
Yeah, exactly. Because it is additive. It's joint,
additive.
exactly.
That's important for us to note. Okay. I just want to go back to the face for a second, because if we're losing hair here, but let me tell you, lots of complaints. The midlife menopausal chin hair, jaw hair that seems to happen. And when it's like one or two, you can pluck it.
Right.
But it's not always. One or two.
Well, we have our favorite device.
Yes.
Let's bring it
so
out.
So I wanted to ask you about basically this. I got this at the drugstore. Very inexpensive. Is it okay that I use it? It's kind of, they call it microderm ablation. It
Yeah.
seems like a fancy term, but all I'm doing is
You're
getting
shaving
the hair
it.
and a bit of, I feel like exfoliated too at the same time.
You're basically shaving your skin, okay? It's a very, very gentle shaver. I've never personally hurt myself with it. I think anybody can use it safely. And you're exfoliating your skin and you're basically shaving the little hairs off. And that's not a myth. Your hair does not become coarser or tougher or bigger or worse from shaving.
Thank you for busting that myth.
I know.
I don't know why I've been told this so many times.
I don't know either. And think of all these men exfoliating themselves so well
They
every single
do.
day because they're shaving. So unfortunately, some women actually do have to shave in more than just this dermaplaning, whatever tool it is.
So do you mean like a regular, just like the 3-blade razor Gillette, or not to name a brand, but that's the one that popped in my head. Sorry, but
I'll say chic. That way we can even it
Yes,
out.
we
Exactly.
can even it out. There's no harm. So it's traditionally sold to men.
Right.
There is no reason we can't use it.
There is no reason. And somebody who actually has terminal hair, okay, so not peach fuzz. So peach fuzz is what the little dermaplaning thing works for.
Yes.
It's not really going to deal with the terminal hairs, the thicker hairs. So the thicker hairs are the ones that we're plucking out, right? So
Yes.
that we know we've
The
tried
bothersome,
that for. Right,
terrible.
it's not really
Yes.
working, right? If someone has a lot of terminal hairs, yes, they can shave. Okay, it's not going to make the problem worse.
Is it better to wax versus shave? Is there a reason to consider one versus the other?
I think the people that are waxing don't have as much hair as somebody who's shaving.
Okay.
Okay, so that if you have to shave every day, you're not going to be able to pull all that hair out. It would be kind of like waxing a man, right?
No.
No.
And what about considering laser hair removal for the face? Does it work well? Is
Laser
it
hair
harder?
removal is great.
Okay.
Okay, but the hair has to be pigmented. Okay, so that so if you're blonde, it's not going to remove the blonde hairs. Okay, if you have hair that is now turned white, so we're not now trying to get rid of the pesky dark hairs, but the pesky silver hairs. You can't use laser on those, but you can use electrolysis, and that works really well. In fact, electrolysis is the closest thing to being permanent, because laser isn't really permanent because it kind of injures the hair follicles. So it's long temporary, I guess would be the best way of putting it.
So good old electrolysis.
Right.
Not
the
to
only
be
trouble
ignored.
is trying to find someone to do it.
Oh, has it died off as a non-trendy thing, or?
Well, I don't think anyone is trained to do it anymore, so that you'll be looking at probably a more mature European esthetician who they've always done electrolysis,
Right.
and you'll have to manage to find someone who's experienced, has the equipment, and is qualified to do electrolysis.
Well, I'm going to run to the drugstore and get myself a 3-blade razor after
You don't
talking
need one.
to you.
Don't talk like that.
Okay, so if there's any top things you want us to walk away from talking to you today with respect to our skin,
Okay.
what do you want to tell us?
Well, something. Why don't we actually teach somebody how to put the retinoid on?
Yes.
Yeah, I brought 2 retinoids with me, along with my French baguette in this lovely French baguette outfit.
It is a perfect market bag.
Okay. So these happen to be ones that I'm using, all right? So that's why I've got them. They've even got my name on. So this is my favorite, the Eraslo, and you've seen me talk about it before. So we'll show people how big a pea is.
That's not a lot, and that should cover our entire face.
That's enough for the entire face.
I would venture
exactly.
to say there's probably some overuse. Of retinol.
It's if you don't show, when you show people, they're actually shocked as to how much you're putting on, all right? So it's covering both hands quite nicely.
All right.
Okay. And the act leaf is another, it was popular for a while. It's RAR blocking retinoid. And it was marketed really more for back acne originally. So the problem, I like this one too, and the good thing is it comes with a pump. So it's even harder to mess up because
easier to
that was
control.
one pump right there. And so it's the same size as what I showed you.
Okay, so proper application is your one take-home message.
Secondly, if you're starting out and you're concerned, you can always even put it over my favorite product, the Neutrogena hand cream. So Neutrogena hand cream is not just for hands, it's for basically all really irritated skin. I love it for baby skin because it's edible, because it's glycerin based. So if your baby's eating like off their face kind of thing, that's fine. It's really good as a lip product for that reason. So it's a really good lip mask. But you can actually use it under the retinoid, and it will allow the retinoid to go in really gradually so that it doesn't
cause the irritation. And things, right.
Okay, so always moisturize under. Can even moisturize. Why don't you try some on?
Yeah, I'm going to try some.
Can even put it on over the Neutrogena hand cream, and then you can always moisturize over as well. So you moisturize like a sandwich. Yeah, it does. It's pretty nice stuff.
Boy, I might have put too much, but okay. So we all do things that we know maybe we shouldn't. Mm-hmm. One of them is sometimes going to sleep with your makeup on if you're just too tired. Is that bad for us?
So it's probably not the end of the world, okay? And I've been guilty of doing that myself. But my advice to people, generally speaking, is that if you're not going out somewhere, so you're not at a social engagement, cleanse after dinner, okay? So most of the time, people, they're not cleansing and they're sleeping with their makeup on because they're just too tired. Things got away with them, and all of a sudden it's 11:30, and then they go in the bathroom and they're just exhausted, and so they just don't take their makeup off. And especially if someone's telling them they have to double cleanse, do this, do that. I mean, that's a production in itself. So what I tell patients to do, and what I've been doing, and it's working for me, so I haven't been sleeping with my makeup on, is I actually cleanse after dinner. Okay, so I'm actually all ready to go to bed.
That's a great way to do it.
Okay, but I'm not going to bed yet. I'm still doing stuff, but I'm ready to go to bed, and then I can do whatever I want. And the other beautiful thing about that is if you also extend that to brushing your teeth at that point in time, you don't eat more junk at night because you've already brushed and flossed, so you'd have to brush and floss again, and that's a lot of work. So
it's a good
gets rid of the midnight snacking too.
Yeah.
So definitely don't kill yourself if you've been sleeping with your makeup on. It didn't do anything really damaging to you. It's not ideal. It just really means that you're smushing all that stuff on the pillow into your face, which is not great. Just try and get around it by cleansing earlier.
What are the 3 best things we can do for our skin?
Okay, so sunscreen, okay, eating well, all right, and that means making sure that you're eating a balanced diet of predominantly whole foods, so not processed foods, and also eating enough protein. And I bring up the point about protein because women in general, especially older women, their protein intake just kind of skyrockets down and declines, and they'll end up seeing me for various reasons, including skin and nail problems. But when you actually speak to them, they're barely eating any protein in a day, and they may eat like a salad with a few little pieces of, I don't know, chicken or fish or whatever. So if you add up, if they're Googling their food and adding up their protein intake, it ends up being negligible. So I actually tell people to aim to eating 70 grams of protein a day and to Google their food just to make sure they're getting that food in.
Which is good for our muscle, as we've learned through
all
this
podcasting
and midlife strength.
Sarcopenia and all that. So there's the sun, there's eating well, eating enough protein, eating non-processed food. I mean, not eating processed food. Let me not confuse myself. And obviously sleep, making sure you're getting your sleep. Okay, so we all have sleep problems to some degree. So you need to try and get your sleep in and do things in the evening to try and reduce your risk of not getting to sleep at a decent time. So getting off your screens, and also minimizing your alcohol intake. And people are drinking more, apparently. I mean, I think it's true.
I think the data shows it, especially
Yeah,
the
exactly.
pandemic, there was a rise, and it seems to have sustained as well,
Yeah.
the rise in alcohol intake.
So I think it's hard to address that with patients. So when I say patients, patients are like a microcosm of everybody, right? Because everybody is a patient for somebody, right? So I saw a post earlier today, but just before I got in the car, and it was a great post. I'm not going to say who shared it, but it said, make sure you have alcohol-free days. It framed it the other way. Okay, it didn't say no, don't drink during the week, or oh no, don't do this, no, don't do that, because I think people hear that, but they don't want to hear it, so it goes, it goes into whatever the back of their mind. But I think that was a very powerful way of making it a positive statement. So it's like, and so that way it could be one day to start with, right, and then take it from there. But yeah, so that the sleep, the alcohol, protein, sunscreen, and also try and relax. Do things you like. Life's too short.
I think that's a beautiful ending message for everyone. The sun is shining on us.
I know, that's
which
probably a
feels
sign.
wonderful because we are in the dark fall days of the Canadian weather. Dr. Sandra Landolt.
And we have our sunscreen on anyway.
And we have
so
our
we can
sunscreen, so
bask
we're
in
good.
it, right?
And my windows have UV filters on them. But I would love to ask you, what
Yes.
makes you feel beautiful?
Oh, everything. But really mainly being able to be outside and enjoy life. And also to feel that I've grown into myself, and being here with you. I feel beautiful
I've really
right now.
enjoyed my time, and I feel beautiful in your presence.
Thank you.
Thank you so much for coming.
Thank you.
Let's talk about Jack 59 shampoo and conditioner bars, because these aren't just hair care products. They're zero waste. They're made in Canada, and they're created by an Indigenous woman-owned company. Now, it doesn't get better than that. And here's the deal. One bar replaces 2 or 3 bottles of product, of course, depending on the length of your hair. Now, not only is this sustainable, but it's perfect. It saves space in your shower, and you can travel with it. Plus, this formula is sulfate-free, pH balanced, gentle. Honestly, I really love it for my scalp and my hair. It leaves it feeling clean, soft, and hydrated every single time. And the scents, they're lovely. So if you're looking for a product that delivers for your hair and reduces waste, Jack 59 is the way to grow.
Thanks for listening today. This podcast is for entertainment and informational purposes only. The content shared here should not be considered professional medical advice. Always consult with a qualified healthcare provider for personalized medical guidance. We're here to empower and support you, but your health decisions should be made with your own medical team. Until next time, take care and keep thriving.